Health, they say, is wealth. In Nigeria, the problem of accessing healthcare is one that is weighed down with a lot of challenges. Those who have the wherewithal prefer to travel abroad to get good health services, since the state of healthcare delivery in Nigeria has dwindled over the years. In Ogun State, this is more profound considering the contributions of the people of the state in the Nigerian health sector. One notable contributor who easily comes to mind is the late Professor Olikoye Ransom-Kuti, whose ideas of a viable primary healthcare system are still yet to be met. Little wonder then that when Senator Ibikunle Amosun took over the mantle of leadership on the 29th of May 2011, he began to make changes in the healthcare delivery system, which has yielded a lot of positive results. This is one of the numerous primary healthcare centers in Ogun State, undergoing reconstruction and rehabilitation. Very soon, it will be ready for use. Raiji Saheed is a resident of Itaeko community where the primary healthcare center is located. He is married and has a child. According to Raiji, when Governor Amosun gives his word, he carries it through. Another rehabilitated facility is the Obantoko Primary Healthcare Center at Odeda Local Government Area. Mrs. Abosede Adenekon, with emotion, narrates how the new primary health center helped to save her life.
Last month, environmental. Mo rí pé ibi báyìí náà ti take care mi. Torí ṣẹlẹ̀ tó yẹ púpọ̀ gan. Tẹ́nìkan wá wó ilé tí mo kọ́. But mo dẹ̀ dúpẹ́ lọ́wọ́ Ọlọ́run pé hospital yìí ó gbà mí sílẹ̀ because mi mọ̀ bí tí ẹ̀mí mi bá ti wà tí ó bá kí n ṣe àwọn ará hospital bá ń toko yìí tí Ibikunle Amosun yìí.
Some nursing officers at the primary healthcare centers also speak of the tremendous changes in healthcare service delivery in Ogun State.
Has done very well. In fact, if you can see, he has changed the future of this generation. It has changed the hearts of the entire members of this community, both the staff and the clients coming here.
This primary health care center, which is called Family Health Center at Alakpo, Jebo, the local government, has just been newly renovated. If you were here this time last year, it was not like this. The wall, the painting, the renovation, there was general renovation all through. This gate wasn't like this. The window, the tiles, including the wall, there was no mini theater before. Like this year last year, there was nothing like that. But now we boast of mini theater in which we can do minor surgeries. There are several improvements on the part of the primary health care in Ogun State, especially in Ijebu-Ode.
Before now, many people resorted to traditional medicine. The reason for this may not be far from the fact that before the present administration came into power, most of these centers were just not conducive for providing the much-needed healthcare services to those in need. The health needs of the people are being met as patronage of health centers increases.
From inception of Governor Amosun, the building changes. There was extension, new bed, new stalls, new instruments, everything changes.
Efficient healthcare delivery is number 2 on the 5 cardinal programs drawn up by the governor in the mission to rebuild Ogun State. The state of healthcare when his administration took over was dismal. Some of the challenges included inadequate funding, lack of basic healthcare facilities and equipment, as well as poor state of healthcare infrastructure. This made Governor Ibikunle Amosun to pledge his support to addressing this, as well as providing free healthcare services for pregnant women and children below the age of 5 and the aged. To effectively carry out this mandate, the first step taken was the reconstruction and rehabilitation of dilapidated healthcare centers in all the 20 local government areas in the state. The reconstruction, renovation, and equipping of the primary health centers included the following: provision of standard and well-equipped labor rooms, standard conveniences, tiled and painted buildings, medical equipment to facilitate health services, sinking of boreholes for fresh, clean water, and provision of a power generating set.
But we have targets like 130 plus primary healthcare centers that we want to refurbish. Then amongst that, there's about 4 or 5 that are going to be built from scratch. Then all our general hospitals, that's 25 general hospitals and 5 state hospitals, those are going to have refurbishments and upgrading done to them. I could give you a long list of machines that we're going to buy and this and that, but basically in terms of institutions, those are our targets. Of course, with regard to all the various statistics, we are of course aiming to hit the Millennium Development Targets naturally by 2015.
With all these in place, the initial reluctance of citizens of Ogun State in visiting government healthcare facilities is now being overcome. As of today, the Ogun State government, under the Senator Amosun-led administration, has completed the renovation and equipping of a total of 45 primary healthcare centers across all the 20 local government areas in the state under the first phase of the exercise, while work has commenced on another set of dilapidated primary health centers for the second phase. This renovation work cuts across all the 3 senatorial districts in the state. In Ogun West Senatorial District, a total of 10 healthcare centers benefited from the first phase of the renovation exercise. They include the following: in Ogun East Senatorial District, 21 primary healthcare centers were renovated and equipped in the first phase of the exercise. They also include the following: in Ogun Central, a total of 14 primary healthcare centers benefited under the Phase 1 of the project. They include the following: Furthermore, higher levels of healthcare services, such as those provided by general and teaching hospitals, have also enjoyed some levels of transformation in the last 1 year. One of such is the Olabisi Onabanjo University Teaching Hospital, where dilapidated buildings in the medical, surgical, and children's wards were renovated. These measures were taken to ensure that the teaching hospital, being the only tertiary hospital in Ogun State, is put in a position to serve the purpose for which it was established. Arrears of staff salaries have also been paid, while employment of new ones is ongoing to help tackle the problem of inadequate health workers in the state. Preventive medicine, which is one of the major aspects of primary healthcare, is also being given adequate attention by the present administration. Thus, in the last 1 year, free treated mosquito nets and anti-malaria drugs were given to pregnant women at primary healthcare centers in Ogun State. When it comes to immunization of children against the wild polio virus in the fight towards its eradication in Nigeria, Ogun State has been in the front line. From organizing quarterly meetings on polio eradication with local government chairmen and traditional rulers, as well as other stakeholders, to ensuring that immunizations are actually carried out as at when due, the Ogun State government in the last 1 year has left no stone unturned to see that its children remain healthy and not suffer from the effects of the polio virus. To consolidate these strides, a state government task force was inaugurated on the 8th of February 2012. Ogun State has thus been rated best in polio eradication in the Southwest and certified free of polio in recent times. The state has also been partnering with various local and international bodies to help tackle the health needs of the people. The Ogun State Governor and his counterpart in Lagos State also came together during the last year to see to it that they unite in the fight against polio. This was via a one-day polio advocacy program tagged Community Leaders Against Polio. The event took place on Saturday, the 11th of February 2012.
I must say that our synchronization meeting with Lagos and other sister states, as well as the Republic of Benin, and the partnership fostered by these meetings have paid off, as evidenced by the 0 cases of polio virus recorded in our state in the last 2 years. It is therefore a demonstration of wisdom on our part to consolidate on this partnership and explore ways into taking it to a higher level. As implied in the theme for the present campaign, community leaders must ensure the success of polio eradication program in their respective communities. Community leaders are therefore expected to sensitize and educate members of their various communities on the need to embrace immunization campaigns and get their children immunized against polio at every given time.
But this is a collaboration that I believe with our community leaders, with our young persons, with the leadership provided by our health commissioners and special advisors, and of course the collaboration between us, the governor, that we can overcome this threat to the strength and the health of our human capacity resource.
In another partnership, the state government, on the 3rd of February 2012, launched an artificial limb project towards further promoting healthcare delivery. This project is a collaboration between the Ogun State Ministry of Health and Rotary International. The project was commissioned at the State Hospital, Ijaye, Abeokuta, and is aimed at helping citizens who were unfortunate to have lost their leg or legs to walk again.
People lose limbs for various reasons, and for many of those people, there's a need to get back, on track again. But then many are unable to do so because of the prohibitive cost of procuring limbs. Rotary, in conjunction with the Ogun State government, has seen that need and they need to put many more people back on their feet rather than allow them to resign to fate, become beggars, or simply sit at home. So a factory like this that will produce artificial limbs for people who have lost limbs for various reasons, to get them back on their feet again so that they can go back to their jobs, go back to fend for their families and be relevant to society.
It was indeed a day to remember for many who were the first beneficiaries of the laudable project.
I feel very happy because the Rotary Club made me to start to walking by myself. I'm very happy and I thank them for what they have done, the beneficiary they have given to us. God will continue to guide and protect them in all their endeavors.
It's okay. I'm grateful. Like I'm the happiest man in the world today. I don't even expect it that I can just stand on my feet. I'm grateful, and may God help the Rotary Service, Ogun State Governor, everyone. May God help them in Jesus' name.
Another fruit of effective partnership was the launching of free eye surgery in collaboration with different bodies such as the NP Group and Indo Eye Care Foundation, amongst others.
As of today, they have given almost 200 people eyeglasses. About 140 received drugs that help them to improve their sight. But the excitement today is, if you look behind me, you'll see a lot of people, about 50 of them, in black glasses. This is because they've actually just undergone surgery. They've been through surgery, and I'm happy to say that all of them have been successful.
One very important aspect of healthcare in Ogun State is awareness creation. In the last 1 year, the Ogun State Ministry of Health, under the leadership of Dr. Olaokun Soyinka, has ensured that citizens of the Gateway State are properly sensitized on various issues and diseases that may affect them. One classic example is the Cancer Awareness Program organized by the State Ministry of Health, where the people were sensitized about the disease. This was on the 27th of April 2012. The awareness campaign was later taken to the Obas complex at Okemosan, where there was a lecture on breast cancer, after which free screening was done for women. In addition to all these, the state government has also taken the following steps in upgrading the health sector in the state. Upgrading to international standard the Central Drug Store for drugs procurement, strengthening of the accident and emergency services